Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
No, please, you can just give. You have already
Sure.
introduced me. No, that's fine.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
So our we have to understand that our brain works through electrical activities. Electrical activities, as we know, in circuits, in any dense circuits of computer or TV, there are a lot of signals being generated, like what you think, what you feel. Even if you want to move your hand or leg, with every micro movement, there are a lot of electrical signals working in the brain all the time. If this signals generation becomes abnormal, it comes like some short circuit in the brain, person experience some abnormal symptoms, and that is what we commonly know as a seizure. So seizure is basically abnormal electrical activity in large part of the brain, by definition.
What is epilepsy?
So when some person experiences or some electrical abnormal electrical activity is generating in someone's brain more oftenly, especially by definition, if this activity or these seizures happen more than two times, and that too unprovokedly. Unprovokedly means like without any non-stimulus, that this condition is known as an epilepsy. Like see in young children, uh, something known as febrile seizure. Like for our viewers who are for the they know that તાવની સાથે મગજમાં ચડી જાય તો એને આંચકી આવી જાય છે, તો that is known as febrile seizures. Like so one such trigger is febrile seizure, high temperature, that causes seizure. Another thing is that when someone gets infection spread in the brain infection, that is also
Yeah.
going to provoke some seizures. So this is not by definition included into epilepsy. Okay, so like any stress or any trigger, somebody has done a lot of starvation, somebody has not slept for a couple of days, they may they may get some abnormal activities inside the brain, so they can also experience seizures.
Yeah.
So these are not included in definition of seizure. So in epilepsy, so someone gets unprovoked more than two episodes of seizure,
Yeah.
that is known as epilepsy.
What are the different types of seizures and do they affect people differently?
Definitely, like definition, there are two kinds broadly. One is generalized and one is focal or partial. What happens in
Yeah.
generalized seizures? A whole part of the brain fires this abnormal electrical activity at a time, and majority of these patients experience unconsciousness. It means they lose consciousness. That is known as
Yes,
generalized
doctor.
seizure. And when only small part of the brain gets involved by this abnormal electrical activity, it is known
Yeah.
as a focal seizure or partial seizure. Here by definition, person does not lose consciousness. So it will be manifested outwardly. Either patient will throw some jerky movements involving both hands, both legs,
Yeah.
uprolling of the eyes, tongue bites, etc., simultaneously followed by loss of consciousness. And while in focal seizure, only small part of the body may move, or in certain seizures, patient may experience sudden fear or apprehension, like that. So yes, they do affect differently,
Okay.
depends on what kind of seizure a person gets.
I see. Now, Can you explain what causes epilepsy? Is there always a known cause?
Uh, it's very good to know that about 50% of the cases, no known cause is identified. I mean, that is when we doctors investigate by doing an MRI, and when we find no organic cause, we known this condition as idiopathic condition. And certain cases we have certain known conditions like somebody with the brain tumor, or old patients with who have experienced stroke, or paralysis attack, or even Alzheimer's patients do get. So these are the known causes, known triggers. But when there is no cause found, then there are certain genetics causes as well. So yes, there are varieties of causes which gives persons epilepsy like diseases.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
uh, See, whenever some person is suffering from epilepsy, most of the time their pattern is usually same, or like someone throwing generalized seizure. So there are some patients do get some symptoms like aura. They may just experience some, that either flashes of light, or some sudden blackout like thing, and then they know that they are going to experience that is as a person. So at the time they should just try to move towards the safe area. And many patients who do not get this aura, so people in their surrounding, how can they identify, like somebody has suddenly become unresponsive. uh, they just they are standing or sitting, they may just drop, fall, or they may start shaking their hands, or their one some part of the body may start moving. Or in certain kind of epilepsy, like in absence seizure, the person may just give a stary look, and at the time if you try to call, the person does not respond. They may not fall, but they may just not respond. And if you ask the person after, sometimes when they become normal, they may not be able to even recall what has happened. So this is how people may identify, people around the person suffering from epilepsy may identify that this or he or she had is suffered a seizure, and they should seek some medical help in this kind of situation.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Been long that their science was not developed so much, and people in the especially in the villages had a lot of other beliefs that regarding the cause of the epilepsy. Now it is in our 21st century, people know it that this is a neurological condition, and it has nothing to do with this bhoot pret like things. And it is a medical condition which can be controlled, and person can have a normal life with just medications, with proper control of the medicines. Stigmas has been so bad, like people used not to even get close to those people who have experienced epilepsy. Even during my childhood, I knew one of my teacher in the village had epilepsy, was an epilepsy patient. And whenever he had epilepsy, people just kids used to run around. People used just school would just get close, everybody would just run. And there were people, because people had no idea what is the epilepsy, and like that people avoid getting mixed with them. People even try to avoid their children. Some people don't try like to even employ those people with epilepsy. They don't easily. So these are must, but with proper understanding, with proper education, and by creating awareness, we can definitely help these people suffering from epilepsy, and give them almost normal life with proper control of the epilepsy.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Most important trigger in people suffering from epilepsy to get an attack is the stress. So if a person is under stress, either physical or emotional or mental, they are bound to get the epilepsy attack, so a seizure attack. So they should have proper sleep. They should avoid excessive fatigue, physical efforts. They can have, although have normal physical activity, they should take a regular medicines. Very important. If this is also very known that if you miss the dose, you may get an epilepsy attack. So it's very important to follow all the proper instructions, and you can have almost normal life.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Uh, my final thought to the patients and family, and to all the normal people, that we should know this is a medical condition, neurological condition, and people with epilepsy, if you come across someone and if they are not on proper medical treatment, they should just try to educate them and just bring them to proper doctor, a medical professional, physician, neurophysician, neurosurgeons, even psychiatrist. Wide varieties of doctor can definitely help you out, depend on what locations you are. And just take take regular medicines, and you can have almost normal life. So thank you so much, and I hope this definitely help us creating more awareness in the society, and make everyone seek the treatment and have a normal full life rather.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.